Yeah, rare diseases, I think, are rare in many ways, not just in terms of the number of affected individuals, but I think we have to remember the individuals themselves, the patient organizations, the foundations, the advocacy and support groups. You cannot do any of this work in developing a treatment for a rare disease without involving the patients and the support groups. I'm humbled by the contributions made by the patients, the selflessness with which they commit themselves to a natural history study which may have no bearing in terms of a treatment benefit for themselves, but they still come along. If I use Pompe as an example, the muscle biopsies, the nerve conduction studies, the EMGs, the blood draws that we ask of these patients, and they selflessly give, and give. So I really remain humbled because I think that from a selfish perspective, it's made me a better human being, but I think it's really allowed for the drug development pathways. So we cannot do this in this rare disease community without the patients. I think they are the community, and we as physicians or industry, the academia, I think we all partner with the patients, the families, and the advocacy groups right in the middle of it. And they have raised awareness for the disease. The patients come forward. They come from all over the country, from all over the world when the need is there. And I'll give you an example of Pompe disease. As we were doing the drug development, I remember the adults telling me, Dr. Kishnani, focus on the children because they are dying. Our time will come, but for them, if you don't do this today, there is no tomorrow for them. How unselfish is this, but how important it is to recognize how they look out for each other, but how they have given and continue to give. And even when a therapy is approved and we come up with new therapies and we still request and ask of them, can you participate in protocols and trials? It is very rare that I hear an answer no. They're always willing. They're participating in registries. We really ask a lot out of them, but they're always willing to do it. So a very big thank you. And I don't think a thank you is big enough, but a tribute to them for all that they do. So thank you again. And thank you, Rare Disease Reports, really, for allowing me this opportunity to express myself on behalf of not just myself, but my colleagues, staff, and other members at Duke, and colleagues around the world for this huge trajectory that we are seeing in the rare disease space today. Thank you.